I want to first just address the notion that we're putting a lot of time and energy, and where we start with that is the notion that we're required to do so, and we're required to do so on a couple different levels. Those are here in front of you on the 4 bullet points. Um, but as soon as it's required, then I think the follow-on question is entirely appropriate, right? And that's, well, okay, it's required, but why is it required? So the general idea, I would say, to answer that kind of follow-on question, is the idea that our response and our ability to successfully mitigate pandemic risk is multifaceted. There's a wide variety of tools that we bring to bear in an attempt to make our campus safe for both our employees, visitors, and our students, everybody in between. So this is just one tool among many, none of which is the silver bullet to kind of solve the issue, but all of them together gets us to a point where hopefully we can move forward in a prudent and responsible manner. The slides are set up in a format, and I'll address that now, so that we are attempting to go through the presentation in a manner by which we've received lots of your questions as you signed up on the front end, and we want to address those questions as much as possible, and hopefully try to hit most, if not all of them, as we get to the end of the presentation. So in the bottom left corner of every slide, there's some FAQs. So these are pulled from your questions received and kind of grouped into blocks as you signed up for the presentation. And I will also say we've had quite a bit of time spent ahead of the formal rollout, where we had a pilot program and some similar questions came up along the way. So what I'm going to attempt to do through the slides in the presentation is to pause on these FAQs for every slide, and just anticipate that by the end of the slides, I am hoping that the vast majority of the questions will be answered. We certainly will have some time for Q&A as well. So on this slide, frequently asked question, is this required if working from home? Answer, no. So the symptom survey as a starting point, the idea is that we are trying to ensure that access to a facility is granted only to those persons that don't have symptoms, have not been exposed to COVID, right? Have not been tested positive for the last 14 days. So if you're not coming into campus, then there's no need to take the survey. Second bullet point here, how does this address issues with asymptomatic people? Answer, basically, it doesn't. I will say that the survey will show some of the examples of the questions from the survey. The survey has symptom-based questions, but it also, again, it asks if you've been tested positive over the past 14 days, and also if you have had close contact with a COVID positive person over the last 14 days. So obviously, if you've had close contact, you're not necessarily asymptomatic, but so it addresses that particular issue. So again, back to the point that this the survey is not a be-all end-all for anything. It's just simply one more tool in our mitigation response efforts. All right. So what is it? The survey is based on Qualtrics application, and so you can take the survey through basically any web browser, that be on desktop or a mobile device. After you take the first survey, I'll say the questions are set up so that your identification information does something it's called in programming lingo, it will persist to the next time that you take the survey. So we're asking for your preferred contact methodology. So, you might have a campus email, but you prefer to be contacted by Gmail, for example. or you have a campus telephone number, but you prefer to be contacted by your cell phone. You fill that in once, and you don't have to fill it in again. Part of that, I'll say, technology is linked to the fact that the Qualtrics application has authentication on the front end. So we get a lot of benefit from going through the credentialing process prior to getting into the survey, and not the least of which is the fact that we have some pretty tight security and data management benefit by doing that as well. So the application asks for symptoms and exposures, and then pretty straightforward, it gives you an answer, so to speak. It generates one of 3 letters. And the letters are basically approved, and it shows up as green. We'll show some examples of that. Or not approved, and that shows up as red. And then there is a middle ground that I want to touch on just to put it out there. The middle ground is the notion of a healthcare approved portion of the survey. The reason why we have that is because CDC guidelines carve out essential healthcare workers under a different, I'll say, response protocol than everyone else. So the survey is designed to accommodate that carve out for healthcare variation. So a healthcare approved notice coming out of the survey is encapsulated with yellow. So we have green approved, red not approved, yellow for healthcare. And as a practical matter, what that means for someone that has a yellow output is that they're approved to go to work in their appropriate healthcare facility, but they are not approved to enter and access other campus facilities for other business aside from proceeding to work. All right, so I'll move to the FAQs. If you go from one building to another, do you have to retake the survey? Answer is no. The idea is that the output that you get from the survey is you get an email, so that'll be generated from Qualtrics on the back end. But as you take the survey, for example, on your mobile device, you immediately get the green or the red or the yellow. So what you can do is screen capture that, so that you have it, in your photos folder or whatever. And then when you go to the next building or the third building or the fourth building, to the extent that they have some access control set up immediately prior to entering the building, the idea is that you just simply show your phone. So you show that pass, so to speak, and that's universal across anywhere on campus. And so what do you do for non-affiliates? So we have a manual process, and I'll talk through that in more detail, but it is in recognition that the survey as it's set up right now for data privacy security reasons primarily, but again, we get some reporting tools on the back end as well when we have that set up with their credentials on the front end. But obviously we have other scenarios where non-affiliates come through. So we have a manual process by which to handle that scenario, and we will cover that in more detail. Okay, implementation. So I'll just jump to the bottom there. The expectation is that every campus facility has some form of this implemented at their facility by the start of fall quarter, identified as September 23rd. A little bit of background, right? So we launched the survey in middle of August. I want to say, and I want to emphasize, that implementation is flexible. So there's not one right way of doing this. In fact, I'm going to give some examples of how we have talked through some, I might say, primary ways, or maybe the most common ways. But that doesn't preclude you from coming up with another idea for how to implement. And I want to make sure that that's on the table, And to the extent that you have a different idea, that you have a better idea, just ask that you share that with us so that we can all learn from it. To the extent that it's a better way of doing things, we're certainly open to all of that. But the implementation process, to be clear, is intended for anyone accessing any particular facility. So it's students, it's employees, faculty, non-affiliates, visitors, right? So you have to have a process for everybody that accounts for everybody. All right. You take the survey, you go through the questions. What happens? All right. So we wanted to show some examples of what the output looks like. If you haven't taken the survey already, this is what it is. So green approved, yellow is the healthcare approved. And again, the note at the bottom there, you can access your healthcare facility to the extent that you need to perform essential work. But what happens when it's not approved? You get the red. So there is there are letters that come with all of this. On the screenshot you have in front of you here, on the green and the yellow pictures, there's some of that text that comes with the letter. On the red, the text is not showing, but to summarize what the letter says, it's pretty straightforward. It's number one, don't come to campus. Now, so let's just carve out a couple obvious. Let's say you live on campus. You're in on-campus housing. Yes, you can go to your on-campus housing. Let's say you have an appointment at Student Health and Counseling Services because you, as a student, need to follow up with some care. Yes, you can access the Student Health and Counseling Services facility. Obviously, call ahead, make an appointment, etc. But the letter itself is pretty straightforward. It's don't come to campus. Notify your supervisor if you have one, because if you're not showing up to work, just like any other protocol where you're not showing up to work, you have a responsibility and an obligation to notify your supervisor. You need to follow up with your primary care physician and follow the advice of your primary care physician. Might be nothing, and it might be something. But you don't return to work until you obtain a return to work slip from your physician and you present that to your supervisor. That's the general kind of output workflow. I'll move to the FAQs, right? So first one, will there be a change to allow supervisors to receive emails for their employee? The answer is no. So there is a balance in the technology behind the survey. And that balance is that the more complicated we made the survey with, I'll just say the bells and whistles, the more drain on this, from a technical level perspective for returning those outputs timely, the more risk there is for errors in the process. And then frankly, for this question specifically, attempting to link up an output from an employee to a supervisor, it's actually a little more difficult than it sounds at face value. So we had to balance this idea between complexity versus ease of process and I'll say efficiency. So the quick responses, that kind of thing. So because of that, we are certainly balancing that need further on the easy button, and that means less complex process. So no, there's not going to be an automatic type of notification process built in at any time in the future. Does the system automatically send an email daily to remind everyone? No, not at present. There's certainly the potential, I would say, not from the system, but perhaps from a different mean and method. I'm not. We might come back to that. I will say I'm not a big fan of that at the moment, but certainly as we gain more people on campus, more students on campus, and we get more experience with higher volumes, we might need to come back to that. the third bullet point. Do I need to report through a not approved finding through the report COVID at ucdavis.edu? Simple answer is no. So these are two distinct processes. This process for symptom survey is the process by which we are vetting people for entry into a facility. It is not a process by which we are identifying COVID positive people. Symptoms create concern, and as a best practice, we want to keep and make sure that sick people stay home. So this is a tool to encourage and facilitate a bit of a process to keep sick people home. That's different from the mandatory reporting, where as a matter of policy, we need to report when there is a COVID positive person in our community, so that the COVID positive mitigation and response protocol can address those scenarios and those individuals. So two different situations. So if you're a supervisor, you put a fine point on this. If you're a supervisor, you get word from your employee that they received the not approved process. The simple response is you say thank you. Please follow the instructions on the letter. That means follow up with your primary care physician, obtain a return to work slip, and we're good. Simple as that. Okay, so what happens to the data? This is an important question for the data security integrity. We're on the front end, collecting answers to symptoms tied directly to an individual. So there's some concern about what that means. Where does the data go? So let me address that. Qualtrics is the system on the front end that collects those responses. So that's the Qualtrics system. Within the Qualtrics system, our admin IT has been able to establish a process by which the data will be deleted automatically multiple times a day. Multiple right now, I believe, means 3 times daily. The answers to the survey are just completely wiped off of the Qualtrics system. And if I'm remembering correctly, from a technology perspective on Qualtrics, this is binary. It's either you wipe everything or you keep everything. We move that data. So as we wipe the data, we move that data into the lockdown Cognos system, data warehouse, okay? But we do not send all of the data. What gets sent to Cognos is that contact information and the outcome from the survey. So specifically, the outcome means one of 3 options: pass, healthcare pass, or fail. The symptoms do not get sent. Whether you've been tested as COVID positive and you answered that question, COVID positive, does not get sent. The question regarding close contact, if you've had close contact in the past 14 days, that does not get sent. The only thing that gets sent is that contact information, and then again, the outcome of the logic embedded within the survey. Okay, so what are some of the questions around data? So who's going to be office of record for these files, both electronic and in paper? So this is a good question because it presupposes the notion that we're keeping paper. We are not. You should not keep paper. So we will come back to the manual process a little later in the presentation. But the manual process is set up on this notion of paper. We do not want you instructing people to fill out the paper form. You use the form to administer the survey on a verbal basis. You collect verbal answers, and then assuming that the answers allow entry into the facility, then the individual gains entrance to the facility. To the extent that those verbal answers indicate that you may not allow entrance into the facility, the toolkit has basically an outcome letter, very similar to the letter that the survey would kick out with a no pass response. And it provides basically some information. No, you may not enter the facility. We recommend that you follow up with your primary care physician and whatnot, but we are not retaining any paper records. The Office of Record for the electronic records, so again, now we're talking about the Cognos data, is risk management. Admin IT, I think technically, manages the data warehouse. Maybe it's someone else, I could have that wrong, but risk management is responsible. But I will also say that the Cognos data, I forgot to mention this, is retained on a rolling 30-day window as well. So data that is older, data collected and retained in Cognos that's older than 30 days also gets wiped immediately. We'll talk about reporting later on, what you can pull out of Cognos, but the point being is that with some level of reporting access through Cognos, do not expect to pull data, for example, that's 2 months old, because it just does not exist. I'll go to the second bullet point. Why don't you ask what facility someone's entering for contact tracing purposes? So the simple answer is that entering a facility does not equate to contact tracing. Entering a facility simply means that, again, we're trying to protect the other occupants of the facility and maintain a safe facility. But just because you enter a facility does not mean that you have close contact with anybody, for that matter. So you could walk down the hallway, walk past 5 people. Those 5 people that you walked past and shared the same space with, those are not close contacts. Close contacts are defined as someone that you interact with closer than 6 feet and greater than 15 minutes. So that's why there's really no reason to maintain data regarding someone accessing a facility, is simply because it's not actionable. Okay, so reports and records. So we talked about the fact that Cognos will retain some output data. The Cognos reports are still in development. They're not live, and we anticipate being able to turn some of this loose relatively soon. I'll talk about kind of who has access, but I wanted to share just this is a screen capture of one portion of what the Cognos report would look like. So so what you're going to get when we have the Cognos reports available, again, is 30 days worth of data. I think the proper term is the roles. So how we divide that data and who has access to that data will come through a matrix that's in development right now that will be provisioned at the senior leadership / dean vice chancellor level. I could say it maybe a different way, is that we already prepare workers' compensation dashboard reports. We have a matrix that is divided by school and department, by which senior leadership has access to this data in that kind of report format. We're going to start at the same level. So what that means is a dean or vice chancellor designee will have access in the first round of updating our Cognos reporting access. We'll have access to that college and school level data. With that access, I might imagine that person can delegate the ability to then break that by department as that school, as that dean, as that vice chancellor sees fit, so that within that school, within that college, obviously there are subgroups, and that data can be broken by that subgroup. But the point that I'm trying to make is that as we develop the Cognos reports, our first rollout for access to the data will be at a pretty significantly high level. Okay, we talked about record retention, again, in the data warehouse within Cognos, only 30 days, and please do not keep paper when you're administering the manual process. Not a good idea. FAQs, who is responsible for collecting the data, especially if there are multiple departments per building? So there's, I'll go back to the flexibility. There's not one way of implementing the process. So I'll give one example. Let's say you have one building with multiple departments. I would say that there are two I would say primary methodologies that you might anticipate implementing the collection of the symptom survey. The first option is that the departments within the building agree that it is best to control access at the envelope of the building. So what that means is we're going to station someone at one or two entrances to physically interact with people that come into the building. You set up a table, have an A-frame. Here's the QR code for taking the survey. We have the manual process, right? If you're interested in that, I will say that part of that support mechanism for doing that, if you are interested, is through the Aggie Health Ambassador program. So we will be setting up a methodology by which you can request that support. There'll be a two-way street for how we agree on what that person does in a support role. To be clear on that point is that that person administrating the envelope process, they're not a compliance person. They're not going to confront people. They're simply going to facilitate the process. Okay, so that's one answer, for example, for a building that has multiple departments. I'll give another example, and you know, this example, I call it in large part the easy button. I'll say this is what safety services is implementing, and that is you establish an expectation with your employees that if you're entering the facility, you intend to show up on campus, that your employee that takes the survey, when they get the response to that survey, they push that email response to the supervisor. So the supervisor has a record on a daily basis, knows that, okay, you know, Eric was supposed to go in today. Here's the AM in the morning email response that Eric received verifying that I took the survey. And that goes into a folder that you can pull up at a later date. So that's another kind of easy way. If you've got multiple departments, you're not interested in coordinating with the other departments, you set up that kind of a internal workflow. Second bullet point, how do we ensure our faculty are filling out the symptom survey when our staff aren't there to monitor it? I'll go back to the answer to the first question. That is that there's multiple ways of doing it. That second example I just gave, faculty, you could set up the same expectation. So this is part of your facility-specific worksite COVID response plan, right? Is you build in, okay, as a department, this is our expectation. Our expectation is that you push your email to your appropriate supervisor. In the case of faculty, maybe that's a dean designee. Or second answer to that second bullet point question is you've controlled the envelope. No one gets in to the building without validating that they've taken the survey. So that applies to everybody, visitor, staff, employee, faculty, same answer. Okay, I will move on to compliance. So what are the kind of the minimum required elements of the process, right? The bottom line is that the facility, your department, if you have multiple departments within a building, you have to have a process. That's the starting point. That process needs to be detailed in your site-specific plan. You have to acknowledge that we have a process, and this is how we're going to do it. And that process, for most every facility, you need to contemplate, both an affiliate process, meaning people that have credentials. Again, the survey is pretty easy. And then to the extent that the UPS driver shows up, needs to access the facility, what's your manual process? So another example, let me address the UPS driver. That's kind of a common question also. You have an uncontrolled envelope of a building. There's multiple departments in the building, but the UPS driver's got to drop something off at a desk somewhere. So another example of your workflow is that at that front desk, when someone's dropping off the package, you print that manual piece of paper in the toolkit for what the manual process looks like. You might laminate it, you might put it in a sheet folder. You put it on the, you set it on your front desk there. When the UPS driver comes in, you politely make sure, hey, I really need to make sure that you're masked, that you have your face covering on, and can you please answer these questions before I sign for the package? Something to that extent, right? So you have to have a process. That's the first required element. And then you have to have a process for review. So you can't just put the process in place and walk away. You have to have some manner by which you're validating that the employees in your department are actually doing that. And there's a couple different ways of validating that. But I will point out that, keep in mind, the data retained in Cognos is not in excess of 30 days. At the absolute bare minimum, you need some kind of a review process for the purpose of making corrections, right? Behavior corrections, at the bare minimum, no more than 30 days, because you're just not going to have the data available to act upon. As a best practice, I would suggest that there be some kind of review every week. Other options for, again, how you implement, how you comply. Bullet point number 1 there under the options, we talked about controlling the envelope with a screener. Another option is verification at point of service. So there's quite a few departments across campus that they're doing something transactional. As a requirement for that transaction, if it happens to be in person, is that you require verification of the symptoms survey. Show me your green pass, verify it for the day before we begin that transaction. We talked about the third bullet point. That's kind of the easy button. You set up an internal process where you forward that email. And then you can also implement a badge or sticker system. On the toolkit, we have a Avery, specific form for days of the week. We came up with a template for what that might look like, so that Monday looks like one thing, and then there's a Tuesday sticker. And the way that we envision this process for stickers anyway is that you print the sticker, and to the extent that you have a control process internal to a facility where people are looking for stickers, again, that's at your discretion, but you might take that sticker on the Avery label, you take a magic marker, and you initial that and write the date. And that's, it's as simple as that, so that when everybody in the facility knows that the envelope was controlled, and if you see someone that doesn't have a sticker, well, then you can expect to be asked, hey, did you make sure that you took the survey? There are use case scenarios that are different across campus for the sticker system, some that make sense, some that don't make sense. But what we are not going to do, I will say, is implement a campus-wide universal sticker, where you have to order a set of stickers and they're colored or they're symbols or something like that. Our campus is so big, there's a lot of different ways how we do business, and it's just, from a logistics perspective, it's just not tenable. And then that last bullet point there, your ideas, right? So you could envision a better way of getting this done, and we want to hear it in case you do. FAQs, can we implement an honor system? So I take that question to mean the idea that we're gonna throw up the survey, we're gonna send out an email, and we walk away. No, you can't do that. You need some kind of a verification process to make sure that as a facility, you have the process in place. I'll go back to the fact that this is an expectation from public health. It's an expectation under our health policy. It's an expectation from Office of the President. So no, we have to do something to make sure that we're actually doing it. Do we have to check everyone when they come in? So again, we designed, the idea for implementation is flexibility. There are very porous facilities, or, well, there are very porous facilities where there's multiple entrances, and then frankly, I'll just say that we have operations where from a resources perspective, it just doesn't make sense to control the envelope, or perhaps the use case is just so minimal, right? We just don't have a lot going on. No, you don't. So you implement a different type of verification process, be it pushing an email again on a daily basis, be it at those kind of internal checkpoints where you have a customer service desk, or other ideas. Okay, accountability. Along the same vein, so we have a new emergency health policy, and that policy describes an escalation process. And I want to be clear about what that means, and probably more specifically what that does not mean. What that does not mean is calling the police department because someone refuses to take the survey. So I guess the example I might give, and I will say that going back to the escalation process, communications is being worked on, where those escalation processes and procedures will be more readily publicly available. As a general statement, I will say that our escalation process follows existing escalation for kind of any other policy that we have where we have non-compliance. It's just that we're thinking through on a, I'll say an escalated timeline, what that means for students, for staff, for faculty. And the protocol for what that looks like, we intend to be able to publish. That's in the works right now. What that does not mean, right? So you might, I can take this policy, I can apply it to, for example, wearing a face covering and non-compliance with wearing a face covering. Take this policy, I can apply it to refusal to take a survey. If you establish the envelope, for example, you have that checkpoint, by no means, again, going back to either a resource that is staffed by the department, or a resource, for example, that's staffed through the Aggie Public Health Ambassador scenario, we don't expect that person, right, to bar entry. Someone that just outright, says, I'm not doing it and you can't stop me. The expectation is for escalation. If it's staff, it'll go to a supervisor. If it's faculty, right, that goes to academic affairs. If it's students, that'll go to student judicial affairs, and we simply follow that process. It's an expedited process, but we follow that process. The only time that you might contemplate calling the police department is if there's the perception of threat of harm, that there's the perception that someone's out of control and they're about to throw a punch, right? That's really the only scenario that we can envision where you need to call 911. And really that is the scenario. But we're not calling the police for just someone that is, I'll even say politely but firmly refusing to abide by the policy. That gets escalated through our normal process. FAQs, can I deny access? Absolutely, that's the expectation. You deny access. Someone comes in, they say, hey, I didn't take the survey. The answer is, well, I can't let you in. That person says, well, I'm gonna come in anyway, regardless of what you say. You say, well, okay, I certainly can't stop you, but I just want you to know that I do have to escalate that. Second bullet point, where is the best place to go for updated policy information? So this will be on the Campus Ready site. And again, we expect to have, I will say, clear communication on the escalation policy linked to the emergency public health policy as well. So information on the symptom survey, information on the health policy, escalation processes, those will all be linked to Campus Ready. All right, outside visitors and vendors. So I'll go back to the notion that, again, we have non-affiliates, if I can generalize that group. Non-affiliates, those are people that do not have credentials, so they can't get onto the Qualtrics survey. What do? Well, they still have to complete a survey. There is a manual process. It's in the toolkit that you can use. And then I'll also say here in parentheses, someone shows up, they're an affiliate, but they left their phone in their car. Okay, well, if you have the manual process, you're controlling that envelope of the building, or maybe they're at a point of service, right, at a front desk, you can still administer the manual process, whereby you just ask the questions, you validate that verbal answer, and then you're good to go. That's a paper-based system. There's the toolkit that you can print those questions. I'll say those questions are the same as what you're going to find on the electronic version on the Qualtrics. And again, don't ask people to fill out the paper and keep the paper. That's just not necessary. FAQs, how does a non-affiliate show proof of completion? So I'll take this question and kind of apply the use case scenario where, let's go back to the FedEx driver. They're making multiple stops along the way. Couple different answers. First answer is that within a district, so I'll use VetMed for example. I believe they have a stickering system. Within a district, let's say student dining services, they're getting multiple deliveries and they got to do multiple stops for dropping off food at different locations. You can feel free to establish your own stickering system so that the certain drivers that arrive in the morning. You work through that process, and delivery driver A that you see every Monday, as you're implementing the process, you establish a sticker process. You give that person a sticker, and you know that they're going to make 4 more deliveries throughout the day, and those are going to be at the other facilities that you control. By all means, set up the process that they only have to take it once, and then they display their sticker at the other locations. Across campus, where someone is making multiple stops at completely disparate locations, sure, it's entirely possible that person will need to verbally answer the question multiple times. Second bullet point, how can we implement this in a building that doesn't have a receptionist, houses multiple departments, that doesn't allow us to check all entering the building? Best answer to this, I'll say, is do your best. It's just really what it comes down to. I'll also say that I'll go back to the notion that if the department or multiple departments is interested in establishing that envelope control of the facilities, again, we have a method that we can do that through the Aggie Health Ambassadors. And then the final thing I'll say is, can we make an electronic survey available to non-affiliates? So the simple answer right now is yes, and that's a recent development that we've been able to, I'll say, skinny down the survey and the data collection so that we can meet our privacy and security obligations, so that we're not collecting data. That's probably the best way for me to put it. So that is in development. And we will make that available. And generally speaking, what it might look like, again, is a Cognos survey where on the front end does not have credentials, has the same questions, although I will say that some of the logic will be removed. We're going back to the simplified version, and that the outcome is very binary. It's going to be pass fail. There's not the yellow in between. And then I will also say that the pass fail letters will look different. It's important to me. It's important to me so that we do not confuse the two. So as you are managing a symptom survey at a facility, you want your campus affiliates taking the correct survey, because if they're not taking the credentialed survey, then there's no compliance in the back end. You don't have that 30 days of Cognos data to review. It defeats a lot of the purpose, I will say. I'll also say our flu vaccination clinics, my understanding in the future, as directed from Office of the President, is that those will be linked to the symptom survey. So at the same time, if an electronic survey for non-affiliates makes sense from again a business perspective, you can kind of teach some of your regular non-affiliates that are coming in on a regular basis to take a different version, that have a different kind of output that looks different, but again establishes that ease of use. You get to just kind of display it on their phone as a pass. The idea is that yes, we're going to make that available. So that's coming. All right, a little more on the manual paper process. You can find this on the toolkit. Again, I'll mention that the survey, the questions are laid out a little bit different, in that section 1 on the electronic version actually comes at the end, but the logic is explained on the paper process. So it's, again, we're asking about, are you COVID positive, diagnosed in the last 14 days, close contact in the last 14 days? And then the symptoms. So I'll just say a little bit about primary and secondary symptoms. The survey has the logic built in. There are a set of primary symptoms that, in accordance with the recommendations from the system-wide OP task force, I'll use their words, highly correlated with COVID, means that all you need is one of those symptoms, and it's a path. I'm sorry, it's a fail, so to speak. The secondary symptoms are not correlated as much, and those symptoms you need two in order to fail. So if you just have one of the symptoms, for example, you're still allowed access to the facility. Last bullet point there, temperature screening is optional. So we do have some examples where you can add the additional layer of temperature screening. I know that there are some facilities already that are doing that. The temperature screening is optional. The symptom survey is not. So if you want to put in the temperature screening, it is an add-on over and above the symptom survey. FAQ, what if visitor vendor are visiting multiple facilities? So again, if multiple facilities means within a district and it's kind of all under the same umbrella, you are certainly welcome to adopt a stickering process so that that person does not have to take it multiple times. To the extent that we have a electronic version of the symptom survey that does not require credentials, that pass that visitor would take, that'd be valid anywhere on campus, just like the pass, the green pass from the credentialed survey is valid anywhere on campus. Okay, temperature process optional. This is in the toolkit. So if you want to add in the temperature screening process, please open up the toolkit. There's kind of a how-to guide. Again, we want to create some signage. You need to communicate the expectation that you're going to need a temperature screen before going into the building. Establish that process, link it, right, memorialize it within your worksite plan. Make sure that whoever is conducting the process has trained on it, reviewed the process, reviewed the outcomes, understands that there's no need to escalate at that point of entry. It's just simply a report that'll be handled again separately through the escalation process. There's some minimum equipment, obviously, that's required, and I'll just say that the process is designed to ensure the safety not only of the screener, the person that's waving the wand, as well as the person that's being screened. So that's why we want you to be familiar with the how-to. Okay, FAQs. Will temperature screening be required to enter my building? Maybe, maybe not. It's kind of up to you. Who will provide thermometers to perform temperature screening? So allow me to say that I do have a certain stockpile of thermometers, and if as a facility you want to implement this process as an incentive to coordinate with our office, I can make those thermometers available while supplies last. If we do temperature screening, do we need to complete a survey too? Answer is yes. The survey is mandatory. That's the baseline. The temperature screening is optional, and that's the add-on. Okay, I think we are near the end. So I am hoping thus far that we've answered the vast majority of questions and scenarios, but these are some things that we just couldn't find a good place to put them. So I'll just, we have 2 slides of this on. I'll go through them bullet point by bullet point. So should employees send a screenshot of their daily approval letters to their supervisor or forward their email? Again, this gets back to process and how you and your department wants to implement the plan. Either one's fine, really. You know, I'm of a certain generation that it's easier for me to forward the email than try to figure out the screen capture and go that way. But, you know, if the screenshot's better for you, hey, that works just as well, in my opinion. Which survey should UC Davis health employees complete while on Davis campus? So when you're on the Davis campus, take the Davis survey. When you're on the health campus, take the health survey. So geographically based is probably the easiest way for me to answer that question. Can we implement a colored sticker system like at UC Davis Health? So again, we considered that and came to the conclusion that this was a logistics nightmare. Our facility situation at Davis, it just looks a lot different than the health facility, right? So the med center, I think it's 15 stories. There's a few access points that they can control. A stickered system, that makes sense to the extent, and I'll say it's also ingrained in their culture. They have a badge, you know, a badging system. You don't walk around their campus without a badge. So the implementation of a universal colored sticker system, it's just a lot easier from a logistics perspective, whereas on the Davis campus, not so much. And again, I'll get back to the notion of flexibility. I really wanted to make sure that I recognize that your operations, they're not homogenous. I recognize that they're different. We want to make sure that you have different options available for implementation. So answer is no on that third point. Is there a way for a manager supervisor to check and see if their staff have completed the survey each day? So forwarding an email is the easiest answer to that. So you implement an internal process. You set an expectation. That's probably the better way to put it, whereby your employee is responsible and required to forward that email. Once we have Cognos up and running, there's nothing stopping you from establishing an internal process by which you're pulling Cognos data on a daily basis. That's up to you. That's entirely possible. I don't remember exactly. I believe that the upload into into Cognos will match the wipe of data from Qualtrics, meaning 3 times a day. So that's something to consider if indeed you're interested in that kind of a daily check. I'll move on to the next slide. I think this is our last slide. Yeah, so, all right, on a human resources front, do unions need to be notified? And what about leave for an employee who is not approved to enter? So yes, unions have been notified, worked with employee labor relations, and that's, I'll just say, check that box. And then leave for an employee who is not approved to enter. So we have a variety of leave programs. I think some apply to this scenario, and again, forgive me, I forget the name of each program, but I will say that early on we established a leave bank that is good all the way through, I want to say, December 31st of this year for use on basically any COVID related scenario. That would certainly apply, as would sick leave, as would other leave options. But I will say that the idea anyway is that prevention from entering a facility because you're sick, which is basically what it's boiling down to. Again, don't forget we have campus-wide policy that memorializes this idea pretty simply, and that is if you're sick, stay home. So if you showed up, you take the survey, and you're sick, well, you could expect that you're not going to get entrance to the facility. Yes, you need to take sick day because of that. Second bullet point, how will this process intersect with campus COVID-19 testing plans? So I think the simple answer to this is that it does not. The question perhaps presupposes, I'm not quite sure what, but let me, maybe the better way for me to handle this is to describe the two processes. The symptom survey, again, is a process by which it's just one more tool where we're trying to establish a safe environment for our community within a facility. So you don't enter a facility until you take the survey. COVID testing plans is the notion that it's another tool in our toolkit to get ahead of and hopefully address asymptomatic individuals. So the idea that we can do some symptom screening on a wide basis repeatedly, hopefully once a week, for our community allows us hopefully to get ahead of community spread. Because if you are asymptomatic and you're taking the symptom survey, you're going to truthfully answer the question, I don't have symptoms, enter the facility, but you could still be potentially shedding virus. So COVID testing plans are just simply another tool, hopefully a very effective tool. Frankly, pretty excited about getting this rolled out, up and running for all of our community, that will help us mitigate the pandemic. Third bullet point, what about the flu shot mandate will be verified through the symptom survey? So there is, we don't have a definitive answer to this yet. I will say, however, the Office of the President FAQ website already has this published, and it indicates that the symptom survey will be used as a tool for validating compliance with the flu shot mandate. I'll kind of star that answer, put a little caveat there, footnote it, and say that I believe that still is a work in process. Maybe that changes, maybe that doesn't. For the time being anyway, I believe that's the plan. Can we get some signs? Yes, you can certainly get some signs. The toolkit has downloadable signage, again, that you can laminate, that you can put on the front of a door. We would encourage that. There's a couple different examples of that. We have A-frame signage available as well. We have some plans to put some A-frames to communicate this message, on a wider scale. Think marketing at some high traffic locations. If you are interested and specifically want some signage, particular location, please reach out. We don't have an unlimited budget for this, but yeah, we certainly want to work with you on that. All right, I will pause. I will take a drink, and I think Grant is moderating any follow-up questions.
Hey, Eric, I just want to say that people thought your presentation was fantastic. I'll start there.
Thank you.
But we do have a number of questions that came in, and one of the first questions that I think I want to start with is you talked about healthcare facilities, and you talked about that there would be a different notification and that people might be able to gain admission to a healthcare facility if they're an essential worker, whereas others might not. Can you talk a little bit about what is a healthcare facility and who determines those?
So the way that you phrase that question, it's actually the opposite. Okay, so let me talk about the concept first. So the concept is that the state of California, early in the pandemic, established some essential industries and some essential workforce. So let me give an obvious example. We need physicians practicing medicine. And so we need to be very careful about taking that industry offline for obvious reasons. So you classify that industry, you classify that worker as essential. Non-essential industries and workers fall into, I will describe it as the public health rubric of how do we stop the spread? How do we minimize community transmission? And one tool in that toolkit is the idea that if you are a close contact to a COVID positive individual, public policy, CDC guidelines, best practices indicates that you quarantine, even if you're asymptomatic. So that applies to everyone except for our essential workers and our essential workforce. It goes back to the notion that we, as a public policy, want to be very careful regarding the when and how we take people, out of work, because we want them working. So the COVID the mitigation strategy for the public at large has a certain threshold where when you're a close contact, asymptomatic to a COVID positive person, that threshold means we're going to stop there, no quarantine for 14 days, out of an abundance of caution, you might describe it, to make sure that you don't develop symptoms. An essential healthcare worker, however, that's asymptomatic, has a different outcome. They're essential, they still get to work. There's a, I'll say, a higher level of scrutiny for that individual, again, to make sure that they're monitoring symptoms, etc. But they're not automatically quarantined. So going back to how Grant phrased the question, a healthcare pass means that it's an essential worker that has had close contact to a COVID positive individual, but is still asymptomatic. That person has a healthcare pass so that they can still go to work at their healthcare facility, but they're not allowed access to other campus facilities. Because again, it's documented, I'll say, it's a known increased risk for our facilities in general, but as an essential worker, they still need to work.
Hey, Eric, can you talk a little bit about HIPAA compliance across the symptom survey. Are there concerns about, an employee forwarding an email to their supervisor? What about asking the questions, the symptom survey verbally, kind of our manual paper process? Can you just talk a little bit about HIPAA and how this doesn't violate any HIPAA rules?
Yeah. Allow me to say that I'm not comfortable talking about the legality, I'll say, of HIPAA. I don't feel like I'm qualified. Allow me to say, however, that there was a full phalanx of attorneys that have reviewed the process at an office of the president level, individual campus level, and I'll just say that the survey in general met their expectations, and that again, it's office of the president mandated, right? So this is the way forward. It's passed the multiple attorney test. And so that applies again, if you're responding verbally to a manual process, same answer. It's gone through that vetting process. Very comfortable with that outcome. Forwarding the outcome letter to a supervisor, again, is a compliant, not a compliant. It's an internal process to verify that your survey procedure is taking place. So whether you do that through Cognos on the back end and pull that data report, or just simply forward that verification by email, amounts to the same outcome. Again, very comfortable with the review, the extensive review that's gone into that process.
Hey, Eric, I got a number of questions around what do we do if the employee made a mistake and they hit the wrong button and they got a not approved? Can they just take it again, and who should they tell, and do they have to go home? Can you clarify that?
Yeah. So the bottom line is, yes, if you make a mistake, you hit the wrong button, that's already happened. We've already got emails. You won't be the first. You can take it again. Let me also say that the Cognos reporting on the back end, we're designing it in such a manner to look for exactly that. So my recommendation to you is, when that happens, please affirmatively notify your supervisor ahead of time. Hey, look, Eric, I just took the survey. I tried to take it a second time. I was going too fast. I feel fine. You're done. That's good.
Eric, we got a lot of questions about people want to make it easy for delivery drivers. Some folks didn't want department necessarily to be responsible for having to check delivery drivers. And so there were questions about, can we when they enter a gate onto campus, can we give them a sticker? Do department deliveries, let's say the driver never comes into the facility and they're just on the loading dock. Do we need to do this as well for them?
The gates, that actually, I wrote that down. Yeah, I'm wondering out loud if through our Aggie ambassadors, we might have a process, again, at the gates where we could administer the survey. That hadn't dawned on me. So that's, I'm gonna take that one back. That's an idea worth exploring. So outside core, right? So that you have a delivery driver that's not going through a gate. Again, we're back to kind of the same answers. But let me think about that notion of, we've got we have a few control points where delivery drivers are going through gates. Does it make sense to administer a survey there? Yeah, perhaps so. I kind of like that idea. And then there's a second part of that, Grant. I'm sorry, I lost my train of thought. There's a second part of that question.
It was a comment really about, I'm sorry, at delivery drivers at loading facilities. So drivers that actually don't come in.
Yep. So no, if the delivery driver is at the loading facility, they're not entering the facility, no, they don't need to take the survey.
Hey, Eric, I've heard you talk a lot about these Aggie Public Health ambassadors. Would it be okay? We have a special guest appearance from Dr. Corey Vu, who's kind of taking the lead on that. Can we let Dr. Vu, Corey, unmute and speak to that just for a couple of minutes?
If Dr. Vu is so willing, I love guest appearances, absolutely.
Thanks, Eric. Thanks for the great presentation. I heard you mention the Aggie Public Health Ambassador several times. So I just want to let everyone know that the program is one that we are, I think we're trying our best to hire a team of about 250 or so students on campus who's going to focus on educating the campus community about healthy behaviors, at the same time help us address COVID-19 non-compliance in the fall. And so for some of the things that Eric talked about, if your building or facility needs help, with the Aggie Public Health Ambassadors, please contact me directly. And then we're still in the process of working out the logistics and everything else for this program. But knowing the need, that will help us very much with the planning. So please reach out to me directly, and I will do my best to help you, your department, with the students, because we plan to deploy them all across campus. And they will be helping us, engaging with other students and provide education and help us with the compliance. So thank you. Please do that, and then I will do my best to help you. Thanks.
Thanks, Corey.
That was great. Appreciate that. I forgot one other question related to delivery drivers I want to tack on. And that's about those delivery drivers that have their own key. So those delivery drivers maybe that could let themselves, or vendors that could let themselves into a facility. Any thoughts on how you might make sure those folks are complying?
No, off the top of my head, no. But I am interested in those use case scenarios. So I'd like to be able to do something there. I can think, so there's a couple things that come to mind that are just half-baked, so I don't want to say them out loud for fear of regretting them later. But if you have some examples of what that looks like, vendors, delivery drivers with keys, please share them. Let's see if we can think through a way that makes sense.
Hey, Eric, another kind of series of questions that had come in were people that were curious about construction workers. So those individuals, oh, hey, lo and behold, we have another special guest appearance. Do you mind if we take Jim Carroll off mute?
Not at all. Mr. Carroll is welcome.
ADC
Yes.
for Design and Construction Management, who can answer the questions about construction workers and contractors in our facilities.
Yeah, allow me to say that
Yeah.
Mr. Carroll designed this response. So thank you.
Jim, are you able to? We can't hear you if you're talking, Jim.
I'm happy.
All right, well, we're going to come back. We're going to come back to Jim in a second. So we talked about people that enter facilities. What about people that are coming to work and or coming to the campus but only want to use the quad or the arboretum, or maybe they have a field assignment and they don't actually go into a building? What are we going to do about those individuals? Do they need to complete the survey?
No need to take the survey. Not entering a campus facility.
Even if you're coming in contact with fellow employees outside the facility?
Well, I'll go back to, you shouldn't be closer than 6 feet. You should be wearing a face covering. So all of those same, I'll say, public health mitigation factors come into play. So again, the objective here, right, is to slow the spread. So let's be smart about our interactions, both indoors and outdoors. But the simple answer is no. You come on campus and you're not accessing a facility, you do not need to take the survey.
And this is a 7-day-a-week process?
If you access,
We do this on the weekends too?
If you access a facility on Saturday, you need to take the survey. Yes, it is a facilities access requirement.
So a couple of tech questions. Why don't we use the exact same survey that they use at UC Davis Health? And also, where should people go if they're having problems, maybe with Duo or with accessing the survey?
Okay, so first question is the use case at health is set up differently. So I'll go back again to the whole idea that health is an essential industry, an essential business. So they, the questions, the symptom questions, they're almost exact, if not exactly exact, if I can say that. But the output letters, the what to do, right, once you take the survey, that's different. They're handling it different. I will also say their survey is open to, all of it is open to the public. They control those access points. They have it designed differently. We do not get the benefit of those Cognos reports and data without having the credentialing process on the front end of the survey. And I will say we don't receive the benefit of the security and privacy protection as well.
All right, I think we've got Jim ready to hop back on. I'm going to unmute him real quick, Jim.
Okay, how about now?
We're great.
Okay, very good. Sorry for that delay. I guess what I would like to say for just a minute here is that the contractors in the original form of the survey we had as non-affiliates and in alignment with the interim health policy 290-01 that we have, the contractors are defined as non-affiliates. Based upon that, they weren't able to use the survey. So what we did is we've given them the manual survey, but because our construction contracts have the contractor's requirement to manage their own site for a whole variety of issues that arise, we've really wanted to give them as wide of a berth as possible while still ensuring that they meet the minimum level of survey requirement that affiliates have on campus. So we have actually provided the contractors a paper copy of the manual process that Eric was talking about through this. So you should know that the contractors are kind of designing their own systems to be able to report back to us. And we put a couple of parameters on them. One, we are very specifically in the policy pulling out our projects into two different categories. One category is an absolute freestanding structure with a fence. You see lots of those around campus, whether it's the TLC or Walker Hall or something, but it's a big building with a fence around it that pretty much affiliates other than people within DCM are not really going inside of that fence. Safety services as well, but the folks within FOA that are dealing with facilities. The other type of project we have is construction in an active existing building. Briggs Hall, for example, comes to mind because we have a lot of ongoing work at Briggs Hall, and we have 4 active construction projects at Briggs Hall at the same time. It's already been challenging, as many of the occupants in Briggs know, but this would make it more challenging if we didn't take, I'll say, a bit of a light touch with regard to what we ask the contractors to do. So we've communicated with them. There hasn't been too much confusion, but there's been some questions. And based upon that, we gave them the manual process. And we said, in your time of trying to figure out how to interpret this data and come up with your plan and how to report, in the meantime, you can use the UC Davis paper manual version. We've also told the contractors we do not want to know your whole list of people who have been cleared to come to your job site. That is your job to manage. What you are responsible to tell us is if people are COVID positive or if you have disallowed people from coming on the site for any particular reason. We're not requiring the contractors to update us every day with this data. We're just basically saying if you get a COVID positive case or if you've asked somebody to leave, tell us that on a daily basis so we can tell people and evaluate within our system on campus. We've been doing this throughout the entire pandemic. We've been communicating with safety services. So this is really no change for the contractors. The only difference is we are now making them communicate the results of their surveys to us every time we have a construction progress meeting, which is about every 2 weeks. So the reason that I wanted to come in here, and Grant and Eric, I thank you for giving me 3 or 4 minutes here, is to say that our contractors also have a very stringent requirement with regard to these surveys. We're giving them a wide berth to manage it themselves, which really helps us from a contractual standpoint. But the big picture is we're giving them the ability to manage their sites. So I'm sure we might have some questions that respond to that. I plan on hanging on if it comes up, but can also respond back through Eric or Grant after the webinar ends here. So Grant, thank you. Eric, appreciate it.
Thanks, Jim.
Jim, before you head off, one question did come in, and that was about escalation process if anybody sees a construction worker that's maybe not complying with face coverings. Any suggestions on that?
Sure, and we have seen this throughout the pandemic. I mean, we've got a lot of eyes on campus. We have tried very hard to convince our contractors to keep their face coverings on and keep their distance. I'll try to give you the example that I tell most people, and since we have a nice good crowd here, this might help. Face coverings are always required on the job site, and physical distancing is required when it's possible. But when you've got 2 workers on each end of a 12-foot long piece of drywall, it's easy to stay 6 feet apart. When you've got 2 contractors on each end of a 3-foot kitchen cabinet and they're trying to hang it up, not so much. So we have allowed the contractors to come up with their own processes of when they are inside of 6 feet. That doesn't say that they should remove the face coverings, okay? Many of them have gone with face coverings and also face shields as well. But again, that's their bailiwick. It's their process to develop. Again, it gets more complex when we're in buildings when other affiliates are also in the buildings. So I appreciate the commentary. We've actually started to engage Aggie hosts to walk through our projects, not as an enforcement tool, but as sort of a gentle reminder to just kind of look, make eye contact with the subs and say, hey, don't forget, put your face covering on, make sure to keep your distance, and it's just a reminder. We're often seeing contractors on their lunch break and they're overly close and they're taking their masks off, and that's just one we're going to have to continue to remind people. We're not in a business, at least on campus, we have not been in a business of citing and fining people for these. It gets very complicated in the construction world because the safety requirements for job sites are within the contractual requirements of the general contractor. So Grant, back to you.
Hey, Eric, in the last minute that we've got, I just wanted to, thanks, Jim. I'm sorry to
Sure.
cut you off in the last.
No problem.
I have a question about how long we're going to keep things and how long we want to ask people to keep things, papers specifically. Let me find Jim again, and I'm going
to. Grant, you broke up a little bit on my end. I think it was the question.
I'm sorry. It was just to reiterate the question about how long should people keep sign-in sheets and emails and the papers that people are allowed to keep. Nothing with symptoms on you, mind you, but the emails that might get forwarded to a supervisor or a sign-in sheet that's signed as part of a registration or coming into the building. How long should people keep that? A minimum, a maximum, does it matter?
Yeah, my recommendation is no more than 30 days. And my answer is based upon, again, the follow-on process for ensuring that the symptom survey implementation for your facility is actually working, right? You gotta have a process that you're checking on it. And in my mind, the worst case scenario of validating that process would be every 30 days. I prefer it to be every week, every 7 days. So in my mind, there's no need to keep, for example, if you're having your employees send you an email on a daily basis, yeah, wipe that folder no later than every 30 days. And again, I'll take the opportunity to remind everybody on the paper process, we have no intention of collecting paper. You can administrate the manual process, which is based in paper, as just simply a verbal Q&A.